At the outer edge of the ripple, impact meets community. For the New England Rural Health Association, this meant walking alongside CBOs, not above them.
Our role was multifaceted. We distributed funding to our community-based organizations and also provided technical assistance, which is this very vague term that in this case really means support in all ways possible.
Instead of dictating from afar, Ezekiel's role was to listen, connect, and help communities respond to what mattered most.
So this wasn't a project where we said, you have to meet with us once a month, or you have to meet with us this often. Instead, it was really, let's find a cadence that works for you where I can be useful to you. So because I was meeting with community partners across the state, then being able to bring that knowledge to a specific organization. So, oh, you're trying to solve something about transportation. Here are some ideas from other parts of the state and even other parts of the region, because our organization works throughout all 6 New England states, that might be applicable to you, that might make sense, connecting people across the regions.
Those connections became lasting. Not just local impacts, but a stronger rural network across Massachusetts.
We have this learning collaborative as part of this project as well, which sort of is in the technical assistance umbrella. And so gathering all of our community organizations together monthly, sometimes once or twice a month, to think together about a specific challenge, to meet each other, to create relationships. And that, I think, was a really successful part of the project, because then those relationships continued outside of that container of the learning collaborative. People met each other and got to know each other in the space that I was facilitating, that we were holding as part of this project, and then independently reached out to each other. Or I would connect people once, and then they would keep talking for years and visit each other's regions and participate in each other's events and become deeper partners with each other.
At the heart of it all was flexibility, trusting communities to decide what they needed most.
I think that the flexibility has been tremendously important in this project. And the way I see that is really about values. It's recognizing that community organizations on the ground know what they need. And so our role in this project is helping to support what needs they're identifying, rather than saying, these are the things we think you need to focus on from the outside.
The dollars may have been temporary, but the impact continues to ripple outward.
We found a new level of connectedness and built a new level of connectedness across rural Massachusetts that we didn't have before. Organizations in this project that we funded were able to sort of step up to the next level. We provided funding that went to a lot of core staffing, and some organizations have been able to sort of parlay that into finding additional sources of funding that have let them keep a similar level of staffing.
For Ezekiel, the lesson is clear. Investing in CBOs is the surest way to move the needle in rural health.
These smaller rural organizations are just the most effective at getting work done in rural communities, because they have deep community relationships. They have trust in communities where trust is hard to come by. And also, I think the small rural organizations are fundamentally nimble. They can adapt to whatever the emerging issues of the day, the emerging crises are, which is really powerful to see. When you invest in small organizations that are deeply connected, that are ready to do the work, that are primed for it, I feel like you can get really stunning amounts of impact, and again, really actually move the needle on issues that otherwise, you might find that you've invested a lot of time and energy and money and you're like, we haven't got anywhere. And I think often that's because you're not actually connected to people living in the place. And that's what these rural organizations bring to the table.
This is what happens when vision, partnership, people, and community align. One ripple becomes many. This is the rural effect.